So chimeric antigen receptor T-cell therapies are novel immunotherapeutic strategies which are showing transformative efficacy in myeloma. The patients with relapsed multiple myeloma who've been exposed or have disease that are refractory to the three main classes of drugs have very poor outcomes in the era prior to immunotherapy. However, the advent and availability of these transformative new drugs has really been a boon for our patients. What we have seen that in the older studies, KARMA and CARTITUDE-1, we saw ide-cel or idacaptogene biclocel and cilta-cel or ciltacabtagene autoleucel showing dramatic improvement in outcomes for these patients. With the cilta-cel studies, we saw median progression-free survival that was just under 3 years, which is really transformative for this patient population. With that information and how well patients were doing in the multiply relapse setting, there was an interest in trying these approaches in early lines. The thought is that in earlier lines of therapy, patients are fitter, they have fitter T cells, as well as they have less resistant disease. And so with that in mind, these CAR T cells have been studied in the context of KARMA-3 in patients with relapsed myeloma with 2 to 4 lines of therapy, as well as in the CARTITUDE-4 study, which looked at lenalidomide refractory multiple myeloma with 1 to 3 prior lines of therapy. And what we have seen is that both of these studies in their respective settings have shown a significant improvement in progression-free survival, to the point that in the CARTITUDE study, cilta-cel compared to standard of care settings showed a 74% reduction in the risk of progression and death. So these data are indeed very exciting, and based on these are now approved in earlier line setting. At this meeting, we're seeing for the very first time the overall survival data from CARTITUDE-4, which at the most recent data cutoff shows that there has been a significant improvement in death with, per the abstract, a 43% reduction in the risk of death with earlier line use of cilta-cel compared to standard of care Dara Pom-Dex or Pom-Velcade-Dex, which is really a first in this setting and really sets the stage for its wider use in this setting. I think now with the US data, we feel compelled that this is even a more important strategy than we did before with this dramatic efficacy. But additionally sets the stage also to see what CAR Ts can do in the newly diagnosed setting, and we're very excited as we sort of explore the CARTITUDE-5 and the CARTITUDE-6 study and test this CAR T cell in patients with newly diagnosed myeloma and hope to improve their outcomes even further.